think that is a very difficult question, and it's I think one that ties to our history. I think the main reason is dealing with our socioeconomic status, and education and income are the main reasons why we have a higher rate of cancer deaths in our communities of color. When you think about um, our income, most African Americans, more importantly, is how can we work hard to take care of our families, take care of our children. We don't have time to actually go to the doctors. Another reason is we don't have any income. We don't have insurance, and so it really creates a barrier to actually seeking and actually going to the doctors. Number two is thinking about where we live. And if you think about history, and there's been lots of data that shows that there's pockets of places in our communities where there's higher rates of asbestos, higher rates of lead, which all contribute to increases in cancer. And so, these are things that we as African Americans can't necessarily change. And so these are some of the main important social factors that are, creating these higher incidences of our higher rates of cancer incidences as well as cancer deaths. Um, Another major reason is kind of the lack of trust. Um, in our history, we look at the experimentation of things such as the Tuskegee experiment and how uh, this historical context or these major things have caused a major uh, issue with trust in our African American communities. And so when we don't have someone who looks like them or who looks like us in the healthcare field, then of course there are questions of, oh, are they doing this to make money? Are they doing this, are they trying to um, uh, um, are they trying to do another Tuskegee experimentation? And so these things are, I think, some of the major reasons why it is hard for African American uh, as a whole to do better when it comes to healthcare. If you look at about a third of African American women, they report that they have experienced some form of racial discrimination at the office or with their healthcare providers. And so I think there are a lot of things that we can do better to try to mitigate these issues that we're facing.